Hi, everyone, and welcome to the Otolaryngologic Clinics podcast series. I'm Stacy Eastman, the managing editor for the series here at Elsevier. Otolaryngologic Clinics is a bi-monthly publication consisting of review articles focused on a central topic. Today, we will be discussing the October 2022 issue dedicated to Complementary and Integrative Medicine and Nutrition in Otolaryngology, guest edited by Drs. Michael Seidman and Marilyn Wong. Here now is the consulting editor, Dr. Sujana Chandrasekhar, to lead the discussion.
Hi, I'm Dr. Sujana Chandrasekhar. I'm the consulting editor for Otolaryngologic Clinics of North America. Today, I'm speaking with the guest editors of the October 2022 issue of Clinics, and that's on Complementary and Integrative Medicine and Nutrition in Otolaryngology. My guests today are Drs. Michael Seidman and Marilyn Wong. Dr. Seidman is Director of Otologic, Neuro-Otologic, and Skull-Base Surgery and the Medical Director of Wellness and Integrative Medicine for Advent Health Systems at the Celebration and South campuses, and Professor of Otolaryngology, Head and Neck Surgery at the University of Central Florida, and Adjunct Professor of Otolaryngology, Head and Neck Surgery at the University of South Florida in the great state of Florida. Dr. Wong is professor in the Department of Head and Neck Surgery at the UCLA David Geffen School of Medicine in Los Angeles, California. She's currently a member of the advisory board for the College of Applied Anatomy for the School of Medicine and a well-being advisor and a member of the Council of Advisors for UCLA Faculty Diversity and Development. Dr. Seidman's clinical practice focuses on otology and neurotology, while Dr. Wong's clinical practice focuses on nasal and sinus diseases, skull-base tumors, head and neck cancer, thyroid and parathyroid disease, and snoring and sleep apnea. So I'm very excited to have the length and breadth of the United States covered, the length and breadth of otolaryngology covered, and to be able to talk to these two experts about a subject that is very meaningful and of which many of us don't know enough. So welcome to both of you.
Thank you.
I have to say both of them are my friends, and it's really, really nice to work with your friends. So let me just set the stage. I said that we don't really know enough about this. So let me tell you why I'm saying that. Complementary and Integrative Medicine, or CIM, and it used to be called Complementary and Alternative Medicine, or CAM, and I think that CIM actually makes much more sense. Their remedies have been used for thousands of years, as the two of you noted in your foreword to this issue. Over 60% of general otolaryngology patients and a higher percentage of subspecialty care patients use CIM in one form or another, but only half of those patients actually disclose that to their treating otolaryngologists. Dr. Matthew Miller writes in the opening article of this issue. And that's a real problem, right? If we're to provide good healthcare to people, we really need to know what they've tried, what seems to be working, what seems to be not working, and actually what they're using that might counteract something else that we're advising them to use. We all think that we understand the importance of nutrition for health, right? So I think on Sesame Street, they said, you are what you eat. Like, I think I've learned you are what you eat since I was a little girl. But most physicians and nurses and other healthcare providers really don't have any academic grounding in nutrition. In 1985, the National Academy of Sciences in the United States published a groundbreaking report recommending a minimum of 25 hours of education in nutrition in medical school. That is really a small number, I think, and only less than 50% of schools to this day offer that minimum. So education in nutrition is somewhat lacking, and education in CIM is even less. And this disconnect between what our patients are seeking and in fact using and what we as physicians know is alarming. This represents a real knowledge gap, and I'm very grateful to you, Michael and Marilyn, for stepping in to fill this gap for us. You've done this beautifully in the October 2022 issue of Otolaryngologic Clinics of North America, which is on complementary and integrative medicine and nutrition in otolaryngology. You've put together 19 articles that cover this area in great detail, and I'm really excited to talk to you about most of these articles in an overview of the subject matter. Let's start with your backstories, because you're both hotshot surgeons, what we would call allopathic healthcare providers, or in America, we'd call them traditional healthcare providers, and in the rest of the world, we might call you something else. You're highly qualified. Tell us how you got interested in incorporating CIM and nutrition into your practices. And I think I'll start with Dr. Seidman. So, Michael?
Hey, thank you, Dr. Chandrasekhar. So nice to be here with you, Suj. Dr. Wong, thank you, Marilyn. I played semi-professional racquetball in high school and college, and I worked out 2 to 4 hours a day. I ate 8,000 calories a day, of which most of it was pizza, nacho cheese, Doritos, and Coca-Cola. Not a very good diet, as you can imagine. And my undergraduate degree, and I did this because I knew I was going to be a physician, was in human nutrition. So I actually graduated from University of Michigan with a degree in human nutrition from the School of Public Health, because I know that most of us, as you've already alluded to, are considered the experts in this, yet we know nothing about it. And actually, most medical schools give you less than 3 hours of lecture on nutrition in your 4-year curriculum, and we don't care. Chiropractors, and there's a role for them certainly, get 6 weeks of training, much more than we do. And they frankly know a lot more about nutrition and health than we do. So with my terrible diet, 8,000 calories, I realized I wasn't probably getting the nutrients that I needed. I studied the 1935 Senate Act that said the nutrients grown in our ground are 100 times less potent and nutritious than they used to be. And the facts are that 95% of people living in America eat less than 1 helping of fruit and vegetable per day. The American Cancer Association, American Heart Association say we should be eating 10 helpings of fruits and vegetables. And it's not that much, it's a half a cup. Yet most of us are eating less than 1. So I realized I wasn't doing anything right for my body. And so in my dorm room, I had vats of ginkgo biloba, vitamin C, vitamin E, and everybody else down the hall, you'd see smoke coming out of the door room in Mosier, Jordan. And they say, yo, man, check out Seidman. Seidman's got powders, man. And I'm like, what? I'm like, yeah, these are vitamin E and vitamin C. And, so anyways, and we're going to talk about Yilmang in one of our endocannabinoid chapters a little bit later on the road. But, so I just really knew doctors knew nothing about it. And I realized that I needed to get involved. And then my NIH funding was all on that. I looked at aging, mitochondrial DNA lesions. I had $1 million grant from the National Center of Complementary and Alternative Medicine studying extracts of red wine and aging and bioinflammation. And there's a lot of science behind this. And this has been around for thousands and thousands of years, yet we learned about this a long time ago, but have disregarded it. So I knew that we just knew little about it and we needed to know more, and got my degree in human nutrition and studied herbs. And so I can now treat most medical disorders with an alternative. And this book really addresses a lot of alternative options. So I'm going to encourage everybody to take a jump at it.
Thank you. And Marlene, how about you?
So I've had a lifelong interest in health and well-being. I went to medical school at Loma Linda University, which is a faith-based institution with a long tradition of belief in spiritual, mental, and physical wellness. And I've been a lifelong vegetarian, always interested in health and activity. And it led me to looking at more natural remedies, including for cancer. And so in my cancer research laboratory, we started looking at curcumin for treatment of head and neck squamous cell carcinoma. Started off, of course, with cell lines and moved on to other animal models, and actually now are running clinical trials. But I received NIH funding to study curcumin for suppression of head and neck squamous cell carcinoma. We found very, very promising results. And that led me to continue to look, there are natural herbal remedies for so many of our ailments, specifically otolaryngology ailments. And I met Michael when he was chair of the Committee for Complementary and Integrative Medicine at the Academy. And we shared this common interest in nutrition and well-being and health. And I took over as chair after Michael stepped down. And we just have continued working together. And this clinic's book is kind of a culmination of many years of collaboration.
I love that. I love that our journeys take us to intertwine with each other's journeys, and that always makes things better. I have to say, as an Indian American, I grew up just assuming people knew that there were herbs to treat things, and assuming that when I had a sore throat and my auntie, roasted some almonds and some black pepper and had me suck on that people knew to do stuff like that, right? And cumin, for example, is a huge ingredient in Indian cooking. So I think it's very interesting to try to, rather than work in silos of even ethnic upbringings, to try to bring those, as you said, thousands of years of knowledge together. Michael, can you define CIM for us? And you said there's some science. So really, is there any scientific validation for complementary and integrative medicine?
Yes, to that second question, there's a lot of it. And as Marilyn told you, she's got research grants. I've had research grants. I have an hour-long lecture on the power of prayer. It matters not what you believe, but that you believe, as an example. To answer your definition, complementary integrative medicine basically comprises those practices used for the prevention and treatment of disease that are not taught widely in medical school, not generally available in hospitals, and not usually covered by health insurance. And integrative medicine is kind of what Marilyn touched on, is it's a healing-oriented medicine that draws upon all therapeutic systems to form a comprehensive approach to the art and science of medicine. So it's culminating in the power of the body, mind, and spirit. And we were taught to ignore mind and spiritual things in medical school and focus on the body, but there is so much ability of the innate power of the body to heal itself. And there is extensive evidence and compelling studies on this. My trilogical thesis that got published, I think, in 2000 was looking at specific nutritional supplements and caloric restriction and age-related hearing loss and cognitive decline. And there are studies looking at prayer and hypnosis and guided meditation and herbal supplements. There are so many studies out there. And as you alluded to, so many Americans are using them, not telling us. And so, for example, St. John's wort is a commonly used herb for depression, for mild depression, and it can inhibit with the anesthetics that you use, and you can die. So you got to tell your doctor that you're using these things. And certain common things like ginkgo and garlic and ginseng that people use can increase your risk of bleeding. So you need to tell your doctors about things like that. But there are extensive studies that have dated back over the last 20, 30, 50 years demonstrating efficacy of this. And Marilyn's written some of the articles, I've written some of the articles, and many people outside of our spectrum have written them as well.
So as I was reading through this issue of Clinics, that Miller article, which is the first article in this issue, has a box that just sort of lists, for those of us who like lists and like to know what it is we're talking about, the categories and examples of complementary and alternative therapies. And they range from, botanicals, probiotics, dietary supplements, to the, as you said, the psychological, the meditation, the psychotherapy, the mindfulness. I mean, I talk to patients with tinnitus all the time about mindfulness and about using the power of their mind and their spirit to help themselves. There's physical stuff like Tai Chi and yoga, which, yes, does great physical stuff for you, but also engages your psyche extremely well. And then there's, of course, the traditional healing arts like Chinese traditional medicine, like Ayurvedic medicine. So, there's a fear in allopathic medicine and even osteopathic medicine that the studies that were there before your studies and before your contemporaries were done in a different way, that are not as extrapolatable to Western forms of medical care as they might be. And I think I was struck reading this clinic that they are in fact extrapolatable if you scratch under the surface just a little bit. So Marilyn, I'm going to ask you about diet and nutrition for common otolaryngologic disorders.
The chapter in this edition on diet and health and otolaryngology is outstanding. Dr. Dushak and Dr. Rosenfeld, they actually analyze the various multiple diets that are out there that are often thought to be somewhat healthy, and they are. And there's a very nice table in that chapter listing different types of diets ranging from vegetarian and vegan and plant-based to, low carb and low glycemic. And those are all valuable diets in some sense. There are generally pros and cons to each one of them. With, some sensible decision making, a person can take the best aspects of each one of those diets, and that can really impact specific otolaryngology disorders. I deal a lot with cancer patients, and we know that cancer patients, unfortunately, do not have good nutrition. Often they're smokers or drink alcohol. But now with this new era of more HPV positive cancers, these patients tend to be healthier, more affluent. Their diets are a little bit better, which may impact their better prognosis. But we do know that patients that have a low intake of fruits and vegetables tend to have more cancers in general, including head and neck cancers. And we know that diet can also impact allergies, sinus disease, even the common cold. It can impact your voice. There are chapters in this book that have how we can impact the voice and hearing, tinnitus, and allergies. And so I think if you really get down into the details on which specific foods can be helpful, in general, they're going to be less processed, more natural, whole foods, plant-based, without a high concentration of salt and sugars and artificial flavors. So sensible diets in general are what we would recommend. And then specifically, we want to avoid the high fat foods. We want to avoid the highly processed foods, which can impact tinnitus and allergies. So I encourage the readers to really dive deep into the chapters and look for the details on how they can help their patients with specific otolaryngology disorders.
The new healthcare category of provider called lifestyle medicine, right? I think it behooves those of us who are not lifestyle medicine certified to know these things. I was so happy when both of you took on this task, because to find the information in a single resource is very, very helpful. So when a patient says to me, oh, I'm a gluten, dairy-free, vegan, blah, 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 I can look that up and I can figure out what it is that they're eating and what it is that they may not be getting nutritionally. And I will tell you, coming from South India, the American vegetarian diet, you have to work really hard to get those proteins in. Whereas in South India, there's different legumes all over the place. It naturally occurs. And I think if Michael is right, and my God, the vast majority of us are not even eating 1 or 2 fruits or vegetable servings per day, there's a lot to learn before you can adopt this kind of diet in a healthy fashion.
I think, like we were saying, medical schools, unfortunately, don't give a lot of training in nutrition. And I'm hopeful that our colleagues in otolaryngology and other specialties will carefully read about this, because there's a lot of misinformation out there. Like you said, someone says, I have patients, I buy all my food at Whole Foods Market. And I said, well, other than, taking a big chunk out of your paycheck, that doesn't necessarily mean you're getting healthy foods. So we have to be able to tell patients how to have a healthy, balanced diet and get all of the nutrients, especially if they're on a bit of a limited diet, for example, a gluten-free diet or just a plant-based. You have to really be mindful about how you choose what you eat, because you can certainly fill up, bags of potato chips, and that's technically gluten-free, vegan, not necessarily low fat, but it certainly is in a category that could be considered healthy, but it's not.
I agree with you. So can you tell us, how do we help patients differentiate between evidence-based CIM and, something that we might refer to as a snake oil type of treatment, or a potentially either not beneficial or even harmful CIM type of treatment?
People make fun of things that are not them, right? And I work very closely with some chiropractors, and many of them, there are good doctors, there are bad doctors, there are good podiatrists, there are bad podiatrists, there's good of everything, right? And so, anybody who says I can cure all, is likely a charlatan. And most good acupuncturists will say, give me 6 treatments, and if I can make your tinnitus better, your vertigo better, I will. And if I can't, we got to move on, or we can try some TCM, traditional Chinese medicine, different types of herbs. And I work with a number of chiropractors that are fantastic, that know their limitations. So I think it's like anything else. And it's a difficult thing to do. And I think what we have to realize for our patients is that we're really good at taking out a hot appendix and solving your appendicitis. We're really good at taking out a benign tumor in the middle ear and being done, or fixing a hole in the ear, stapes surgery. We're really bad at chronic disease and chronic illness. And it's not because we're bad doctors, it's just because we don't have good treatment. So chronic diseases like diabetes, like chronic back pain, neck pain, tinnitus, vertigo, arthritis, headaches, fibromyalgia, we just don't do a good job with that. And it's very frustrating for our patients, but it's equally frustrating for us because we really want to help these patients. So 75% of Americans have a chronic illness that they're seeking doctor after doctor after doctor, and they're frustrated, particularly the tinnitus patients that we'll talk a little bit about later. But we have to realize, and I do counsel my patients, there are no cures for this that we know of, but there are things that we can do to help. So I kind of have to leave it at that there are things that we can do to help, but you have to realize that there are no cures for a lot of things that we do.
For some reason, people seem to think when they read something on the internet, it is a scientific fact beyond proof. And so I always caution people, you have to look when you read something, pretend you're in science class. Is there evidence? And where does that evidence come from? If you look at a website and you see that there is a link to this company that's trying to sell a product, be very skeptical. Or if it links to an advertisement for even a physician or a doctor that's trying to sell their services, it's something that you do have to be careful. And, for our professional colleagues, I would say examine the evidence, because there's evidence in the literature. There have been some good studies. There's population-based studies that will look at a certain treatment, a certain type of diet, and they can tell us whether the evidence adds up, whether this is going to be a worthwhile treatment. It's hard.
I love the natural medicines database. It's very expensive. My hospital used to pay for it. My new hospital does not. I paid for it last year, and I used it 3 or 4 times. But they do a really great job about, for example, herbs, the indication, the common names, the scientific names, the contraindications, the cross-react. I mean, it's wonderful. So the natural medicines database, I used to be one of their editors. I think they still ask me from time to time, but it's really a very comprehensive compendium of herbs and nutraceuticals, and most of your libraries, if you ask, will likely buy it for you. And then the German Commission E is considered the best resource for the medicinal use of herbs, and they rate commonly used herbs. They have more than 400 or 500 monographs of herbs like St. John's wort, echinacea. And what most people don't realize too is that echinacea is not just one type. There are at least 9 different subtypes of echinacea. And one of the most common ones that's used in cold and flu formulas is one that gets a negative rating from the German Commission E called Echinacea angustifolia. It infuriates me because this means companies are doing this because it's either the cheapest or whatever. It may not work. It may be dangerous. And so, echinacea, I don't want to go totally off tangent, but it's one of my pet peeve herbs. And it's, we know that Echinacea purpurea leaf works to enhance T and B cell function, but the root of that plant does not have the same effect. And we know that Echinacea pallida root works to enhance T and B cell function, but the leaf of that plant doesn't have an effect. And Echinacea angustifolia, the most commonly one that you can see when you go to a health food store, is a negative rated herb from the German Commission E. Getting a little bit off track with this, but the 2 main sources are German Commission E and the Natural Medicines Database that I happen to love.
And I think some of this information can just be overwhelming, right? So it's like asking us to take another course that we should have somehow gotten in medical school, but we haven't. But we are taking care of patients now, and we are training people now, and we are taking care of families now. I will say that smaller, digestible chunks of information are in fact available in table form in this issue of Clinics. For example, while you were talking, I was looking at the article by Youngblood and Brown. I love these 2 tables because they have a table of nutritional supplements that people are using, and they have a table of herbal supplements that people are using. And just like you said, Michael, they tell you the name of the supplement, what's the active ingredient, why and how it functions, potential adverse effects, and drug-drug interactions. This is really helpful. And I can pull this out when I'm looking and saying, this is potentially why, this medicine is not working for you, because you're actually taking a lot of this, what you consider to be very safe, but, digitalis is foxglove, right? I mean, and it can stop your heart, right? So just because it's a plant doesn't mean it doesn't have true properties. So I think the first step, what I'm hearing is open our minds and open our eyes and see what's going on. And then figure a way to educate ourselves so that we can then pass that education to our patients and their families. Do you guys have handouts that you give? Like, for example, I take care of Meniere's, so I have a handout that tells what is a low sodium diet, and I have a handout that tells dietary ways to manage migraine. Do you have handouts like that? Because there's only so much you can give in a, in an X minutes interaction.
Yes. And I think patients actually appreciate having something to look at, because they tend to forget what they hear when they're spending their time, their 15, 20 minutes in your office. So it's very helpful to give them a piece of paper. So I give them a piece of paper about rinsing their sinuses and taking care of allergies and anti-reflux regimen and nosebleed precautions. And those are all, they're not necessarily what I call complementary, but just common sense sort of natural remedies that don't require prescription. It's part of their lifestyle they need to incorporate. And I think that's very helpful. And I was just thinking when we were talking about this book being such a valuable resource, I think that we should have copies of this book in our waiting room for several reasons, not just for patients to look at, so that they will know that we believe in complementary integrative medicine, so that they won't be afraid to tell us, oh, by the way, I'm taking this supplement. Do you think that's okay? Because I'd rather know, and then I can tell them if it's going to help them or if it might interfere with another medication they're on. And so, yes, I think the communication and the openness is key.
I just want to take a quick pause here to let our listeners know that they can receive an exclusive discount on the issue we are discussing today by visiting us.elsevierhealth.com/expert.
I'm Dr. Sujana Chandrasekhar. I'm the consulting editor for Otolaryngologic Clinics of North America, and I am talking with the guest editors of the October 2022 issue of the Clinics on Complementary and Integrative Medicine and Nutrition in Otolaryngology, Dr. Michael Seidman of Florida and Dr. Marilyn Wong of California. You can find all issues and articles at www.oto.theclinics.com. And you can find all of our podcasts, one per issue since 2017, at the same website or wherever you get your podcasts. So let's do a bit of a rapid fire of particular otolaryngologic problems and CIM for this. So I'm going to start with you, Marilyn. Let's talk about rhinosinusitis.
Yes, so rhinosinusitis, as we know, is a multifactorial disease. And like many diseases, there's actually no cure. I tell patients it's an unfortunate situation that we don't have a cure for allergic chronic rhinosinusitis. We have all sorts of ways to help with your symptoms, ranging from local nasal care to antibiotics, to antihistamines, nasal steroids, allergy treatments. But many people are interested in something they can do in their lifestyle, and I encourage that. So in our chapter, we talk about, lifestyle. We talk about herbs that can be used, including bromelain and manuka honey and things like that are not going to be harmful. They could be helpful. Cypret, which has been used in Europe more than in the US. And so in the chapter, we talk about the different herbs that can be helpful, and nutrition. I had a patient once tell me, not surprisingly, that when they cut out dairy, there's allergies and sinus disease got a whole lot better. And I said, that's wonderful. And they said, but I like dairy. So they were very sad. I said, well, I think you can use it. There's some very good non-dairy substitutes out there that will allow you to enjoy eating and not affecting your allergies. So then in addition to nutrition and herbs, the stress and mental state has a huge impact on allergies and sinus disease. And so I'm fortunate at UCLA, we have a Center for East-West Medicine. And I send patients with refractory disease over to my colleagues. Dr. Ta does traditional Chinese medicine and acupuncture. We've had some great results. We've had patients that go over there. It's like an 8-week treatment. They do Tai Chi, acupuncture, acupressure, dietary counseling, stress management, and they almost all feel better. I mean, how can you not? It's like going to a spa for 8 weeks. And so I think that's very important to incorporate that as potential treatment for our patients with some of these chronic refractory diseases like sinusitis.
Thank you. I was impressed that your co-authors, Drs. Wen and Ta, also wrote an entire article on acupuncture, which I'd be reading because I kind of had a vague idea, but now I know more. I can't do acupuncture, but now I can understand it more when my colleagues or my patients are asking me about it or talking to me about it. The article, as I said, by Dr. Youngblood and Brown that covers allergies has these really very useful list of both herbals. And again, a lot of our patients are trying it or asking us if they should try it. And rather than be like, I don't know, maybe it will help, maybe it won't, I can actually give them a bit of an answer. So I like that a lot. Michael, as I was racing out of the office to get to the car, to fight the traffic, to come home, a car honked directly into my left ear. And I luckily have a big fat head, so my right ear was not affected. Can you talk to us about noise-induced hearing loss and about noise-induced tinnitus as well?
Sure. So at least 10 years of my NIH funding was focused on noise-induced hearing loss and age-related hearing loss. And a lot of the work done out at the Kresge Hearing Research Institute, Jochen Schacht, and out of Oregon, and my colleagues Wayne Quirk, who I used to get the sound booth at about 3 a.m. till 8 a.m. at Kresge Hearing Research Institute in Ann Arbor. That was my slot for the sound booth. And we started doing studies looking at ischemic-induced hearing loss, clamping off the ICA. And we found that we were the first to show that you could generate huge amounts of reactive oxygen species, free radicals. And these free radicals are probably the instigator of stroke and heart disease and Parkinson's, you name it. And so that's kind of became the logic of antioxidants because they block a lot of the reactive oxygen species. So Rick Kopke and Michael Hofer and many others, Len Ryback, when he was the president of the Association for Research in Otolaryngology, we did an entire program on reactive oxygen biology, reactive oxygen species. And there are a lot of studies out there, very good studies, compelling studies to show, and one was done in the military with Rick Kopke and group showing that N-acetylcysteine, NAC, Mucomyst, the drug treatment for Tylenol toxicity, is a very powerful antioxidant. Problem is it's not well absorbed. Same for glutathione. So we know glutathione that in your, it's really hard to get it to be absorbed, but we know that, for example, and this is just from our research, glutathione ethyl ester is very well absorbed. So we were actually awarded a patent for some of our work that showed that we can not only slow and reverse by a small but statistically significant degree age and noise-related hearing loss using things like acetyl L-carnitine, alpha lipoic acid, coenzyme Q10, and an absorbable form of glutathione. And then methionine, some of these sulfur-derived amino acids have shown very strong protective effects. And we've probably published 20 or 30 articles over the years in that. And there is compelling data that this is, very useful in animal models. There are studies in human models. There's a company, Auris Medical, that has a couple drugs out. I was, in full disclosure, I was their medical director. I helped them navigate 2 drugs for the FDA, their first 2 drugs, AM101 and AM111. I bought 1,000 shares of their stock at $6 a share, and I think it's now less than $1 a share. So I didn't invest very wisely. But I believe
you're my group, buy high, sell low.
Oh my goodness!
I like it.
So I no longer have anything to do with them, but I think they're very interesting compounds that can show that you can protect from hair cell loss from these types of things. And so they actually did a study in Germany where they rescued and gave people injected after, you come out of a concert and your ears are ringing because you've been in there for 2 hours. And they showed some highly protective effects in animals first, and then they did some human studies as well. And Rick Kopke and others showed that it was the N-acetylcysteine was protective in gun ranges and stuff like that. So there is a lot of data for this. Some of it you can ingest and protect yourself, and I'm a big believer of that. And we've published a lot of that, and there are research articles out there. And one of the other things, lecithin, which is phosphatidylcholine and phosphatidylserine, are compounds that are in every single cell of our body. And we showed with the aging model that the integrity of the vasculature just goes out the window, becomes very leaky. And these types of compounds that you can just take, you can buy them over the counter, are likely protective. I'm actually 150 years old and just look like I'm 50 something. I take a lot of supplements, as most of you know.
Marilyn, you have already mentioned curcumin as one of the complementary and integrative resources for patients with head and neck cancer. Can you talk to us a little bit more about that? And then you did mention the voice, and I will tell you, professional singers have like these incredible beliefs. We used to host chamber concerts of outstanding classical South Indian musicians and North Indian musicians in our home in Queens. And I remember as a medical student, they would say, oh, now you have to give me my B12 shot. And I'm like, okay. Right? Because and it wasn't just them. I took care of big names in the US who just have these beliefs. So talk to us about what's real, what's not real, both in head and neck cancer. And I think for the more common voice ailments that we see.
Yeah, so just a few words on cancer. And I always caution when people come and talk to me about CIM for cancer. Every time we publish an article about curcumin, I'm flooded with emails with people with cancers from every part of their body thinking that it's a miracle cure, and it's not. I always have to say, we are doing studies in the laboratory. We're doing preclinical studies. We have some clinical trials, but there is yet no complementary integrative treatment for cancer. I send them back. You still need to listen to your doctor. You need surgery, you need radiation, etc. But there's a lot that can be done using an integrative approach to cancer care. And so we generally encourage healthy living, of course, lots of fruits and vegetables. There's things that can be done with traditional Chinese medicine, with acupuncture to help with the side effects or the sequelae of treatment, both surgical scarring, radiation, mucositis, and fibrosis, and things like that. And of course, there are a lot of not just curcumin studies, but other trials going on that are not quite ready to be published or finalized. But there's a lot of potential treatments using CIM, using herbs and things like that. But there's still work to be done. I do believe that cancer patients need to be looked at in a holistic way. And they also need to be encouraged to talk to their doctors about other things they're taking, because many cancer patients will be sneaking in things that they think they might help, like these special mushrooms, etc. And we need to know, because there's a whole bunch of interactions that are potential with chemotherapy and things like that. So I'd refer you to our chapter in the book to have more details about different ways of holistic integrative treatments for cancer patients. And then just moving quickly on to the voice treatment. Yes, there are many herbs that singers use. They probably have their own cocktail. And the common ones would be, ginger, peppermint, eucalyptus, anything that will soothe the voice. And of course, the diet is very important, just to decrease the reflux, the acid irritation of the voice. Unfortunately, professional singers in particular, their lifestyle is just counteractive to an anti-reflux regimen, because they can't eat before they perform. They perform at night, and then 10:30, 11 o'clock at night, they're starving, so they have to eat. But that's like the worst thing they can do for their voice. So it's a dilemma, and I think that's why they all have to have their own cocktails. A low acid diet, which the chapter talks about. Anti-reflux measures, herbs that can help to soothe the voice, and then of course, voice therapy is important. Using the proper technique, breathing correctly, all of those are important.
I just wanted to add that, we published a study looking at resveratrol and another study looking at extracts of green tea. I have epi-3 gallocatechin, which is a very powerful anti-angiogenesis factor. This was an in vitro study and showed that we had a 300 times increased cancer cell kill rate of a glioblastoma line in the resveratrol and in the green tea extract branches. Does that mean it'll translate to humans? I don't know, but I'm not old enough to drink coffee, have never acquired a taste for it, but I drink a lot of green and white and different types of teas and I don't like them, by the way. I just drink them because I think they're good for me. And the last little thing about voice, I wrote a chapter, and I'm sure probably a lot of us, who are listening did too. Mike Benninger and I think Sadeloff put together a really nice book about voice, and we put together a whole chapter on alternatives in the voice as well. So I think there's a lot to be learned from our colleagues in other parts of the world about alternatives that are not necessarily a direct medicine, that have a lower risk-benefit profile and may be safer and less expensive too to try for our patients.
Looking at the article on CIM and voice that was written by Duan Lopez and Jamal, they have this list in table 1 from the Herbs for Voice database. And it does cover all of the things you just mentioned: S. officinale, ginger, peppermint, eucalyptus, sage, and A. montana, how it works and why it's used and how it's used. And I think sometimes my eyes get very tired because the patient will say, oh, yes, this is a packet. There's some packet that they got from somebody, and they're taking the packet. And I'm like, oh my God, I have no idea what could possibly be in the packet. But if they know that we are open to hearing, then maybe they can also encourage their naturopathic doctors or healthcare providers to tell them what's in the packet so that information could actually be shared, as opposed to, oh, I just take this packet that they send to me every so often. I mentioned a migraine very briefly before, but we as otologists, neurotologists, deal a lot with migrainous vertigo, with tinnitus, with hearing loss. Can you talk to us a bit about a way somebody could incorporate CIM into their treatments for those conditions?
Mehdi Abu Zari, I hope I'm pronouncing the name right, and colleagues, including Hamid Dajalian, who is a very close colleague of mine. I mean, really bright people have looked at these things that have clearly said that a lot of what we think is ear pain, oral fullness, and things of that nature is likely some sort of variant of a migrainous disorder. Now, if you talk to a neurologist, they're going to say you're crazy. But, my colleague Jim Atkins and, Hamid Dajalian and all of these guys are now, there's a whole subset of thinking a lot of these things are migrainous related. And so they have some very good treatments. But if people want alternative forms of this, if they're suffering from tinnitus, our academy put together, and I definitely do not fully agree with it, as you well know, I wrote a 25-page diatribe about it, but they said the only thing that works for tinnitus is cognitive behavioral therapy. I think that's good. I think it's helpful, but there are other things that have helped a lot of patients along the way. This particular chapter on migrainous vertigo, tinnitus, and ear symptoms and alternative has a plethora and a very lengthy list of excellent references with validated proof, if you will, for things like neurofeedback and hypnosis and supplements. Some of you know I was chastised by one of our colleagues for being very prominently speaking about the benefits of ginkgo biloba. And clearly in the German Commission E, it's been shown that the proper ginkgo biloba is very helpful for tinnitus and vertigo in the proper dose. So there's one study that people quote where they used a third of the dose. And it's a little bit like saying, gosh, you got a blood sugar of 1,000, let me give you 1 unit of insulin. Well, it's not going to drop you very much. You got to use the right dose for the right thing. With ginkgo and tinnitus, for example, there's at least 18 randomized controlled studies, 11 of which say it's effective and it helps a patient, 7 of which say, nope, it doesn't. So that's true with a lot of the medicine. And again, as you kind of alluded, Sujana, we have to have an open mind for some of these things. And, I don't remember if it was 200 years ago when they didn't wash their hands before surgery. And then the doctor who said we should wash our hands, they told him he was a snake oil salesman, only to find out 50 years later, oh, he was really onto something. We should wash our hands. And so,
and now Listerine is named after him.
Yeah, absolutely.
Yeah.
So I think we got to be careful about throwing stones at our colleagues with things that are a little bit out there. And as we talk about later, some very interesting chapters about psychedelics and cannabinoids, that seems pretty crazy to most of us, but there is some pretty compelling data out there. But there's a lot of very good things to think about with the migrainous disorders and alternatives.
I think the proof is in the pudding. So when I've counseled patients about diet, about lifestyle, about many of the things that the three of us have been talking about, and they come back and they're like, oh my God, my tinnitus is so much less now that they're not drinking like a pot and a half of coffee before they open their eyes, right? People who are having sleep disturbance, I'm like, well, are you falling asleep watching like the scary movie, or politics, frankly, or are you?
That's a scary movie.
Right, which is also a scary movie. But, or are you doing sort of these normal sleep habit things that our grandparents and our great grandparents just did because, the lights turned out. So nobody was doom scrolling on their, cell phones to see how they could irritate themselves before bed. So there are really nice articles that you've included that CIM for obstructive sleep apnea and for pediatric otitis media. And many, many of our patients' parents will come in with pediatric otitis media or recurrent sinusitis and really want to know dietary and CIM options. So I strongly recommend our listeners to come back to the issue and read those articles. I'm Sujana Chandrasekhar. I'm the consulting editor for Otolaryngologic Clinics of North America. It's actually one of my favorite jobs. Today, I'm speaking with the guest editors of the October 2022 issue of Clinics, which is on complementary and integrative medicine and nutrition in otolaryngology, Dr. Michael Seidman of Florida, Dr. Marilyn Wong of California. You can find all of our issues and individual articles at www.oto.theclinics.com and hopefully in your personal and institutional library. And you can find all of our podcasts at the same website or wherever you get your podcasts. So let's switch to a newer addition to the armamentarium or to the repertoire of CIM. Michael, let's start with marijuana. So marijuana is legal for medical use in 39 states and the District of Columbia. It's legal for recreational use in 21 states and the District of Columbia. I don't think a day has gone by since Colorado legalized marijuana that at least one patient has not asked me about the use of cannabis for whatever their ailment is. And I think people are very tuned into this as a potential treatment. You wrote this article in Clinics on the endocannabinoid system with Tepasek and Edelmeyer. Can you clear the air for us?
That was a very good joke, yes. Yeah, so I never encourage the use of smoking of any product. And for the friends and family that I know that use it, I say if you're going to do things like this recreationally, et cetera, you might want to eat it instead of inhale it. Even people are vaping pens. I'm not convinced that they're any safer. And we have a lot of colleagues who have written about that as well. So the endocannabinoid system is part of who we are. It's a fascinating system. So, I wrote this with our fellow from last year and a medical student who did a deep dive in this, and there is really interesting, compelling data. But I did have a patient who, in fairness, was incredibly bright. One of those patients who wanted to see you weekly and would make you kind of crazy, had horrible vertigo, very articulate, very smart, but a schizophrenic as well. And he said, when I spin counterclockwise. When I smoke pot, it makes me spin clockwise. Will you please prescribe pot for me? And so I said, Marinol was a legal form. I think you can still prescribe it, Marinol. And so I reluctantly prescribed it for him, and he was significantly better. I wanted to make sure I wasn't going to lose my license, but it was a valid drug that you could use. So the long story short is CBDs, the cannabinoids. I mean, there are thousands of different types of the CBDs and the THCs, and there's Delta 8, which is, this new thing that you can get in Florida, and you go into a dispensary and it's like, I don't want to say worse than THC, but the people who use it, you can just see these people are stoned out of their minds. And now there's some issues with that. But I do think that there is likely going to be or prove to be a role for the use of CBD, maybe THC, for our patients with things that have chronic ailments like tinnitus and vertigo and things of that nature. I think there may be some potential benefit. There are a lot of studies going on, not enough in our realm, but I think it would be interesting. And I'm hoping some people on here will go to the NIH and try to get a grant study to look at things like tinnitus and vertigo in the CBD system.
Yeah, I agree with Michael. I think there's potentially a role, but I also caution my patients, I don't advise smoking. I've had people say, well, I don't smoke, I just smoke marijuana. I said, well, that is going to be smoking. That had some hard side effects and harmful effects. But yeah, I think there's a lot of research that is going on and it's continuing. And I think we have to keep our eyes and minds open to the potential use. I think particularly for cancer patients that have a lot of nausea associated with their treatment, there definitely is some benefit for use in that setting.
you're saying, well, oral ingestion is better. You're not lighting up something and inhaling, potential toxins into your lungs. How do they know dosages?
So a standard dose of CBD and THC, I mean, they range, but it's about 10 milligrams. So that's a standard dose. But I know people who are, 5 feet tall, 90 pounds, take a dose like that and feel nothing. And I know people who are 300 pounds, 7 feet tall, and take a 10 milligram of something and then they feel it significantly. So when you get CBD and THC in pill form or gummy form, it is highly regulated. So, as long as you're with a legit company, it's very highly regulated in both the recreational and the medicinal realms. It's just if you buy it from, somebody who's growing it in their basement, which is still today technically legal, a caregiver can have 6 plants for themselves and can have 5 patients, so they can grow up to 72 plants. You have 73 plants and you're breaking the rules. Don't ask me why I know so much about this, but that's a separate story. But I am not growing it in my basement for anybody who's really listening there. But yeah, there's a lot of rules and regulations with it. And if you follow the rules, the dosing and stuff like that, I don't think you're going to necessarily hurt yourself. But again, it's like alcohol, right? It's driving under the influence. I mean, if you smoke pot or if you take a gummy that's THC, you're driving under the influence, and that's against the law.
Thank you. I think that's very helpful. So speaking of things that I don't understand, let's talk about psychedelic medicine. So this is something that's really coming up in the mental health field. It's been studied widely for post-traumatic stress disorder with randomized controlled trials. There's apparent overlap between some of the chronic, very difficult illnesses we treat, severe disabling tinnitus, with secondary or primary anxiety, depression. So can you talk to us about what we know now, what we think we're going to know soon? At what point is this something that we could suggest our patients consider?
Well, for some of you know the backside of the story. I asked Benjamin Asher, who used to be the chair of the Committee for Integrative Medicine at the Academy probably 15 years ago, dear friend of mine, New York physician. I said, hey, Benjamin, Sujana asked me to write a book with Marilyn Wang on, complementary integrative medicine. Will you write a chapter on how to integrate medicine into your practice? Because you're doing it. He goes, nope. And I said, oh. I said, well, he says, but I will write a chapter on the use of psychedelics. And I said, well, like, what do you mean? Like mollies and MDMA and ketamine? And he goes, and mushrooms and LSD? And he goes, yes. And I said, please tell me a little bit more. And he said, well, I took the year-long course at UCLA. I think Marilyn Wang heads that, right? You teach that course, Marilyn?
That's my second job.
At UCLA, they have a year-long course to teach physicians how to do this and how to do it safely. And then, what brought it to the mainstream was Nicole Kidman in her little, I forgot what it's called, 9 Separate Stories or 9 Separate, it's a Netflix show. And they're basically talking about microdosing. And so I went back and I was intrigued only because, we stopped doing this in the 50s or 60s because everybody thought people were tripping out and it was, mushrooms and LSD days and dangerous. And I went back to Sujana and I went back to Marilyn and to the publishers. And I told them what happened. And we all kind of scratched our head and said, well, that's interesting. And everybody said, sure. I mean, why not learn about this? And he's, these things are validated as you kind of started this, Sujana. So we were really excited that he took this chapter on, did a really nice job describing psychedelics and their use. And you nailed it. We're taking care of chronic anxiety-ridden patients who have tinnitus and vertigo, chronic headaches and things of that nature. Yet, we call ourselves otolaryngologists, head and neck surgeons, but we all physicians see these kinds of patients. So huge role in PTSD, the studies are out there. Huge role in depression, the studies are out there. Huge role in addiction, the studies are out there. And by huge role, I mean beneficial roles, and people's lives have been changed. And it's not, going out and doing the ayahuasca with our Native American Indians in massive doses. And I'm not going to condone it or not condone it, but because I don't know enough about it, but it's microdosing in controlled settings. And it's fascinating. And this chapter that Benjamin Asher wrote, and I'm thrilled that he said, no, he won't write something about how to integrate, but he will write this chapter. I'm just really excited that the publishers and everybody allowed this to happen because it's fascinating and I learned a lot.
Thank you. I think all of these friendships are planned, fortuitous. And I say that because when I was at the Academy meeting in San Antonio, and I think, Michael, this was not 15 years ago. I think Ben was chair 20 or 25 years ago. I was like, I saw it on the list of committee meetings and I'm like, oh, this is quite interesting. And some of our listeners may know that my parents and I often attend Academy meetings together. My dad's an otolaryngologist, but my mom's boarded in peds medicine and family practice. And so she and I decided that we are going to go to this 6:30 a.m. Back then it was called CAM, Complementary and Alternative Medicine meeting. Again, this was something that I realized I did not know enough and I wanted to know. And I wanted to know what colleagues whom I respected were doing about this. And I think you are absolutely right. This is a new area that certainly psychiatrists know more about than we do, but certainly we need to know about it. Randomized controlled trials were on MDMA for post-traumatic stress disorder, which affects 31 million people in the United States. I mean, it's a huge chunk of people. Magic mushrooms or psilocybin and ketamine are being studied for anxiety and depression. And I think, again, we're all looking for ways that we can help these patients with minimal side effects, with minimal systemic negative effects and maximal benefit. So Marlene, can we talk a little bit about the microbiome? And the fact that it interacts with the inner ear makes me just exhausted. So can you explain this to me?
Yes. So there's the great chapter in this book about the gut microbiome. Now, we've sort of been understand how the gut microbiome can affect GI disorders like inflammatory bowel disease, ulcerative colitis. But how does it cause problems in other parts of the body? And that's where we need to understand this axis, the gut-brain axis, and the way the gut microbiome and the microbes interact with the brain through the blood-brain barrier, and also with the inner ear through the blood labyrinth barrier. So the chapter has some great diagrams. Figure 1 shows a representation of the communication between the gut microbiome and the inner ear axis. And that helps us to understand how, from the beginning of this podcast, we're talking about you are what you eat. Well, what you eat affects your microbiome, and it can ultimately affect your inner ear, which can include tinnitus, hearing loss. We know that sensorineural hearing loss or noise-induced hearing loss cause a change in reactive oxygenated species. And there's another diagram here in figure 2, which shows more detail about this blood labyrinth barrier and how it can be affected by changes in the microbiome. So there's a lot of inflammatory cytokines that are involved. And, these are all affected by what we eat, the antibiotics. We prescribe so many antibiotics for patients for a variety of, everything from ear infections to sinus infections. And that can have serious effects on the microbiome and ultimately in this gut-brain axis.
And I think we hear that from patients, right? We hear that, I realized that every time I eat X, I get Y, right? And so part of it is not just listening to our colleagues or listening to what our patients are taking, but what they're telling us and saying, I wonder why this could be. And I think knowing these axes that we were not taught back in the day is very helpful. I've really enjoyed this issue and I've really enjoyed talking with you both. Let's wrap up with some advice over the lifespan. So we all want to age well, right? And that starts with making healthy choices in childhood, because Michael was disgusting in college, obviously, and some of us were not as disgusting, but many of us did eat very poorly. I remember as a resident, my dad was giving us a lecture and I just fell sound asleep because it's your dad's voice, right? It's very soothing. And he stops it and he goes, Sudge, that Diet Coke isn't helping you stay awake, is it? And, so we all have made sort of random choices in food. So Marlene, can you give listeners a couple of takeaway points from the article by Muqdad and Shapiro on how to counsel children and their parents on making healthy lifestyle choices?
Yes, I think that actually leads quite well into what we were talking about. When we're young, we often think we're immortal and invincible. We can eat as much as we want. We can not sleep as much as we want. But actually, I think that a lot of the habits we can establish in childhood. And so I think for all parents, we understand how impressionable children are. And children don't just do what you tell them, they model you, they copy you. So I think that's important for parents to model a healthy lifestyle, healthy diet, healthy habits and choices. And that starts very early on, even before a child can talk. And I think it's important for parents to realize that what they feed their children is important. Children develop taste early on. And I think it's very important to not give your child a lot of sweet or processed or salty foods, because they'll develop a taste and a craving for it. But if you can replace that with healthy snacks, fruits, vegetables, unprocessed whole foods, they'll develop a taste and the habit for it. And so the chapter by Mukdad and Shapiro talks about establishing healthy lifestyle choices early on, early in childhood. And that actually starts with parents modeling that behavior. And then it also talks about we as ENTs, we consider them like common sense, but for the public, they may not, like keeping small objects away from children so they don't have aspiration of a foreign body either into the esophagus or into the airway, and avoiding, upper respiratory infections by a lot of hand washing, these common sense things. Sometimes we take it for granted. I like to not miss an opportunity to just emphasize some of these common sense type of behaviors to my patients and to parents when I talk to them about lifestyle choices. And then, of course, secondhand smoke. That's huge. A parent might think, I'll just smoke outside. But we have to be very mindful of the fact that this secondhand smoke can really affect a child, anything from upper respiratory infections to asthma to allergies. And so I think the chapter really covers that well. And I would refer our readers to that chapter.
Michael, I'm older today than I was yesterday, and I've known you for a long time. And somehow you're aging much better than I am, because apparently you're 150 and you look significantly younger. So you and Casey wrote the article on healthy aging, and you already mentioned some of the things that you do to protect your cells. I will tell our listeners that Michael does in fact drink a lot of gross tasting teas, and then he takes the tea bag and chucks it on his eyelids. And I'm like, oh my God, man, we're at a scientific meeting. So Michael has always embraced his mindful behavior regarding youthfulness. So give us the secret, man.
So busted for sure. So actually, I work for Advent Health, and kind of like Marilyn, it's, Loma Linda is an Adventist institution. Our patients that are 300 or 400 pounds are not stupid. They know they're overweight. They have an eating disorder, and we can help them. Our patients who smoke 3 packs of cigarettes per day are not stupid. They have an addiction, right? And my patients will say, I will quit smoking when I die. And alcoholics are typically not ignorant people either. They just have an addiction problem that I think we owe it to a society to help these people. But I am a firm believer that we can live to be 150 years and healthy years. I don't want to be, 95 and in a nursing home and drooling in the corner. I want to be skiing when I'm 125 years old. And I think that there are certainly some tidbits. And I was quoted in the Washington Post a while ago for that tea story that Sujena just totally busted me out on, because I do eat the tea, and it's pretty disgusting for sure, but that's a whole separate story. But I hate to say it. It's, when Mehmet Oz would say on national TV, did you know that if you eat less and exercise more, you'll lose weight? And, the people in the audience would shriek and get all excited. But, I'm not sure that any of us are saying anything much more brilliant than that, because we know the answer. It's just hard to make that happen. So that's another chapter in here that we didn't really touch on, that Bob Levine wrote with me. And I worked with him for years on the power of guided meditation. It's automatic pattern interruption. Like, I tell my wife, I've been married for 37 years, and she goes out of town, and I send a picture of Cheetos and Doritos, and I say, honey, I'm cheating on you. And, she goes away and I eat Cheetos. I still love them, but I also, make a bag of broccoli, cauliflower, spinach, kale, and carrots every day. I get to take Saturday off. Saturday, I don't have to eat my vegetables. But the other days I eat those. And, somebody said, oh, it's so cute. Your wife made you a bag of vegetables. I said, no, I make 10 bags, 5 for her, 5 for me. And Sunday we eat them. But I do think that we can all live a lot of healthier years. I can't promise I'm not going to die from something, but we're all going to die of something. There is compelling data that we can slow the aging process through a lot of the things that we've studied based on bench research, and then some of the obvious things. And I go back to creation health, and I don't mean to be religious when I say this, but creation stands, the C is for choice, make the right choices. R is rest, we need to sleep, as Marilyn said. E is an environment, the proper environment. A is activity, get up and move. There was just an article today saying even 10 minutes a day. I don't buy it. I think if, I have a really cute picture of a doctor talking to a patient that says, would you rather exercise 1 hour a day or be dead 24 hours a day? Mm-hmm. So, I do believe that we should be exercising fairly vigorously 30 to 60 minutes most days. Trust, trusting in something, interpersonal relationships, outlook, having a positive outlook, and nutrition. We end with you are what you eat. Hippocrates was right. And I love junk food. I do my best not to. And it's really awkward. Marilyn said, we're rewarding our children. Let's go for an ice cream cone. Okay, well, let's have a bowl of cauliflower. It's kind of hard to say, oh, you did it. You got a home run. Let's have some broccoli. But, we do have to change the taste and what we're doing in the reward system and things of that nature. So I hope I live to 150 healthy years. If I die beforehand, well, so be it.
So speaking of aging, I think we've all heard of these blue zones. And Loma Linda, California is actually the only blue zone in North America. But there's a blue zone in Sardinia, Italy, and in Japan, and in other parts of the world, where it's not only the food, it's not only the exercise, but it's the community that they have. And that's what is a big part of healthy aging. You can't healthily age alone. So the community is important. It's your church, it's your civic organizations, it's your belief system. So I think all of those factors work together to make it healthy for you to age to 150.
I love that. That is the most beautiful way to conclude this conversation. I'm Sujana Chandrasekhar. I'm the consulting editor for Otolaryngology Clinics of North America. Today, I've had the great pleasure of speaking with the guest editors of the October 2022 issue of Clinics on Complementary and Integrative Medicine and Nutrition in Otolaryngology, Dr. Michael Seidman and Dr. Marilyn Wong. Dr. Seidman is Director of Otologic, Neurologic, and Skull-Based Surgery and Medical Director of Wellness and Integrative Medicine for Advent Health Systems at the Celebration and South Campuses, Professor of Otolaryngology and Head and Neck Surgery at the University of Central Florida, and Adjunct Professor of Otolaryngology, Head and Neck Surgery at the University of South Florida in, you guessed it, the state of Florida. Dr. Wong is Professor, Department of Head and Neck Surgery at the University of California, Los Angeles, David Geffen School of Medicine in Los Angeles, California. She is a member of the advisory board for the Council of Applied Anatomy for the School of Medicine, a well-being advisor, and a member of the Council of Advisors for UCLA Faculty Diversity and Development. Thank you both, Marilyn and Michael, for sharing your knowledge and wisdom with us in this issue and on this podcast, as we all strive to broaden our horizons and reach our patients where they are. You, the listeners, can find all the issues and articles at www.oto.theclinics.com, and also hopefully in your personal and institutional libraries. And you can find all our podcasts at our website or wherever you get your podcasts. We've had one podcast per issue since 2017. Please let us know what you think and how we can make the issues and podcasts better, although I can't imagine making this issue or this podcast better. Thank you so much, Marlene and Michael.
Thank you, Suj. It was a pleasure.
Thank you so much. And Marilyn, it was great seeing you here. Suj, great seeing you here.
Great to see you.
You talk about community and you talk about the importance, the blue zone. This is part of my blue zone. It really, there is something dramatically wonderful about having found colleagues that you can trust and laugh with and learn with.
Thank you for joining us for this edition of the Otolaryngologic Clinics podcast series. For an exclusive discount on the issue we discussed today, focusing on complementary and integrative medicine and nutrition in otolaryngology, visit us.elsevierhealth.com/expert. Otolaryngologic Clinics is available for individual print subscription with accompanying online access or individual online-only access, and is also available on the Elsevier electronic platforms Clinical Key and Science Direct. For more information on this series and our nearly 60 other titles spanning all medical disciplines, visit info.theclinics.com. Be sure to follow us on Twitter and subscribe to the Otolaryngologic Clinics podcast wherever you get your podcasts.